And as usual, we equip you with important information regarding different medical conditions to be able to make you able to make informed decisions in case you are presented with a situation that really requires attention. And today we are set to delve deep into food poisoning. I'm sure this is it is really a common condition, and we're going to get to understand from the experts the prevalence rate in Kenya as well as across the globe. So before delving deeper into this, allow me to welcome the guests today. I have two medical officers from Mater Misericordia Hospital, and it's, as you know, every day or every Friday, we have representatives from Mater Hospital. This show brought to you by Capuchin TV in conjunction with Mater Hospital. So let me start with the beautiful lady. Thank you so much for making time for the show.
Thank you for having me.
Welcome. Please tell the viewer your name and what you do at Mater Hospital.
Okay, my name is Dr. Renske. I'm a medical officer and I work at Mater Hospital.
Welcome.
Thank you.
Okay, Dr. Ndirangu, this is not the first time to have you.
Yes.
Yeah, welcome.
Thank you so much.
Okay, I hope you're set for this show today.
Yes, happy to be here.
Great, it is a chilly morning, and that doesn't deter us to bring you important information that really matters to you. So you can be part of this conversation as usual by sending an SMS or dropping your feedback and questions on our social media platforms, Facebook, Twitter, and YouTube. Remember to use the hashtag Health Friday, and our number is 0717 424 866. My name is Sasha Elizabeth. Welcome, let's talk health. So first things first, food poisoning. There are people who maybe when they are told you've been diagnosed with a food poisoning, they would be like, oh my God, who is this that's trying to eliminate me? Who is out to kill me? So could you please tell us what food poisoning is and how different is it from the other poisoning that most of us understand?
Okay. So food poisoning is basically taking in food that's intoxicated, food that could be intoxicated by bacteria, viruses, fungi, parasites, or even chemical toxins. So the CDC does let us know that about 97% of people that do have intoxication is as a result of mishandling of food, of which this happens mainly in commercial and industrial establishments, and the lesser percentage is usually at home. So yeah, that's what food poisoning is.
Okay, so what's the difference? Is it one and the same thing? There's this poisoning that someone can intoxicate it deliberately to harm you?
Well, it could be a type of food poisoning. However, the most common type of food poisoning is infectious food poisoning, which would include, as my colleague has said, bacteria, viruses, fungi, parasites, but less commonly could be some chemicals like arsenic and mercury and lead, and even other things like mushroom poisoning. And that will need to be established in a health facility to be able to distinguish what is the causative agent of the poisoning.
Okay, so what are some of these the most common causes of food poisoning?
So largely food poisoning is caused by bacterial infections, of which the common ones would include bacteria like Escherichia coli, like Shigella dysentery, which causes dysentery, Salmonella typhi, which causes typhoid. There's Vibrio cholerae, which causes cholera, which has been found to cause some large outbreaks of food poisoning, especially in areas where there's challenges with the water supply and issues of sanitation. And then for viruses, the common ones are norovirus, which is quite common in the West. In our setup, we have rotavirus, which is one of the viruses that children ought to be vaccinated from in the vaccination schedule by Kepi. And then there's also adenovirus. In the parasites, the common one would be what we call amoeba, Entamoeba histolytica, and one of its quote-unquote cousins called Giardia lamblia, which is found commonly in contaminated water. For example, if you decide to go camping and you run out of water during the camp, maybe in a forest, and you take some water from a stream and drink it, then you can get Giardia. And then there are also fungi. There are also other types of poisoning that could come from some types of fish. Especially, there's one fish, though not common in our setup. It's called the ciguatera fish. And there's also another fish that's called the puffer fish, which if you eat some of it could produce a toxin that could cause food poisoning and cause an allergic-like reaction. Then finally, the chemical types of poisoning are not too common. Lead poisoning, which is especially because of chronic exposure, is not very common. Mercury is found in some products, beauty products, and maybe if children if some of those products are left lying around the house haphazardly and a child consumes it, they could get some symptoms. But it's not quite a common issue. Arsenic is also found in some pesticides and could also be a cause of food poisoning. But primarily we would be concerned about the infectious agents, bacteria, and the viruses.
All right, thank you. Thank you so much for that profound explanation on the causes of food poisoning. Dr. Renske, how common is food poisoning in Kenya and the wider scope of maybe Africa?
Yeah, so food poisoning is extremely common, especially since it affects school-going kids, which take up majority of the population right now. It also affects the elderly. It affects the elderly because they do have weakened immunity as they grow. And so the way they tolerate food as they grow older is way different, from digestion to excretion and so on and so forth. It also affects travelers. The reason why it affects travelers a lot is because when you travel, you are ready to eat food. And so you do not know if it was thoroughly cooked, you do not know what was used, you don't know if there was cross-contamination. And also, if you do decide to cook from home, it's not like you're going to eat immediately. So having to keep food closed in like a container that's tight could also create a medium for bacteria to grow and continue with the process. And also it could be found in younger kids because they have an underdeveloped immunity as well. You could also find food contamination so common amongst everyone because of how our water source is. We do not have the best water outlets at the moment because majority of us are getting it from different sources, boreholes, city council, and so on and so forth. So yeah.
Oh, thank you. All right, now there are signs that are an indication of food poisoning, so that they are taken to be red flags that something is wrong, and this could lead or could guide you, medical experts, towards food poisoning. What are some of these signs and symptoms of this condition?
All right, so for example, let's say you met for a buffet somewhere, and you had some food without probably washing your hands. Probably the food took too long to come and you were impatient and you just decided to dive in. So the symptoms usually start to appear from a few hours, even up to a few days. The most common of which are diarrhea and vomiting. Sometimes you may have diarrhea without vomiting, and other times vomiting without diarrhea. So for the bacterial agents, for example, there are two main ways that they would cause these symptoms. So there are some bacteria that when they get into the gut, they interfere with the mechanisms that facilitate absorption of the nutrients and the water from the food. And that, for example, would include like cholera. And this type of people would tend to develop watery stools, which are large amounts, and they tend most of the time not to have abdominal pain. They tend not to have blood or mucus in the stool, and they may have vomiting. Then there are other types of toxins from bacteria that invade the lining of the gut, and they destroy the cells in the gut, and they may cause bloody diarrhea or mucus in the diarrhea. And oftentimes you'll find such people may have abdominal pain, which may also be because of some problems with some of the electrolytes like potassium that you will also lose when you're having diarrhea. They may also have a fever, so a feeling of hotness of the body, or they may also develop some chills. Some patients may also have a lot of abdominal cramps. In other conditions, for example, typhoid, there are patients who would develop a skin rash on the abdomen, which would look like reddish pimples. And when these people do come into the hospital, usually for mild cases of infection, the diarrhea and vomiting would not be very prominent, maybe twice or thrice in a day, and tends to resolve over a couple of days. But there are those who would have more severe symptoms. The vomiting is a bit more, they have more episodes of diarrhea, they have a lot of fever. When they come into the hospital, there are signs that we would notice. And as medical people, we would check whether they are dehydrated. So if they are mildly dehydrated, then they would probably have a dry mouth, they would have reduced urine, they would have reduced sweating, for example, from the armpits. But if the dehydration is significant, then we would see that their heart rate is increased, their blood pressure is probably low, and that would be a sign of severe dehydration. The other things that we would want to check for example, in typhoid, sometimes they may have an enlarged liver or spleen, so as we feel their abdomen, we may notice that. And of course, we would also, based on whichever signs or symptoms, then we would determine what kind of investigations to be able to order. But majorly, some may also have a headache, and some may also have dizziness because of the loss of water and electrolytes. But mainly, they would experience just diarrhea, vomiting, and fever.
Thank you. Now, you mentioned that being treated to a buffet. There is a case scenario that has happened to a lot of people who have attested to it, that you go to a buffet or you enjoy a meal with a group of friends, and then it happens that you are the only one who happens to have some problems, to develop some complications later on. It's something that has really sparked some memes and puns on our social media platforms. How do you explain such a situation? Dr. Mugo?
Well, it's unfortunate, but sometimes can be a bit hilarious. There are different factors that could contribute to one person getting food poisoning over the other. One of the basic things would be when the food is being served. When the food is being served,
does you gobble?
Yes. There are some who will choose not to use spoons and forks. There are some who eat using their hands, and again, some may not have washed their hands properly. So that could be one factor. Another factor would be, even if the food was contaminated, probably the food is exposed, they've opened the buffet and there's a bit of dust flying around, the bacteria will not, or the viruses will not be evenly distributed in the food. So by chance, one would have a plate of food that has a larger concentration of the microorganisms than another person. So that could also be a factor. So I think those are some of the things that would come into play when
it
one
has
person...
nothing to do with taking different assortments of meals together.
That could also be a factor because if they are fresh, for example, freshly cut veggies and salads, those would be a larger risk factor for developing food poisoning than probably well-cooked hot meats or rice or ugali that's very hot. So as a principle, I tend to avoid the salads when I'm going to a hotel. I'd prefer to eat hot foods if I'm not sure how they've been handled in the kitchen setup.
Yes, so in essence, it is good to understand your system and also try as much as possible to stick to your dietary needs. All right, so now, Dr. Leez, there are severity levels in every, I think most of the medical conditions have severity levels, and there's a point that you can advise someone to seek medical attention. So who among the patients who are being diagnosed or think they might be having food poisoning should go to hospital, and who should stay at home?
Okay. So when you're thinking of food poisoning, the biggest concern is dehydration, because you're losing electrolytes, whether it's via stool, whether it's vomiting, and so on and so forth. And so severity depends on frequency, for example. How frequent are you passing stool? How frequent are you vomiting? Are you able to eat? Are you able to tolerate any feeds? Also about the stool. Is the stool blood stained? Are you passing out blood in your stool? Another thing is noticing rapid heartbeat. You're aware of your heartbeat, and you also feel weak and dizzy as well. And any experience in difficulty in breathing could also be a sign that you need to go to the hospital, because then you are not having enough oxygen and so on and so forth. Yeah, so we look into that. And then on top of that, we also look into your temperature. Are you having fevers for a long time? Are they responsive to over-the-counter medication? Because you have to pay attention to that. We do not encourage you to take more medication after you've taken it once. For example, if you're going to take paracetamol, we wouldn't advise you to go back and get another drug. If it hasn't worked the first time, we are very welcome to help you in the hospital.
Thank you. Now, this question, I'd like both of you to give in, to put in some input on this. Is this condition self-diagnosable? Because we are at a point when people really have embraced the digital platforms, and that they tend to Google their symptoms and signs to try and establish what could be the medical condition that is presenting the signs and symptoms. Would you recommend self-diagnosis for patients with food poisoning?
The answer would be yes and no.
Why?
Yes, if you are having mild symptoms. For example, you've had 2 or 3 episodes of loose stool that is probably non-bloody, and a bit of vomiting that is non-bloody, maybe 2 or 3 times in a day, and you're not feeling too sick, and probably you can identify a meal that you had that you suspect would have been responsible for developing those symptoms. Maybe you had some food that probably you felt was a bit stale, or maybe a friend also developed similar symptoms. Then by association you can infer that you likely have food poisoning. However, if you're developing more moderate or severe symptoms, you're probably noticing some blood in your stool that's persistent, you have a fever that's not resolving, you're vomiting, quite a bit more often and you're not able to retain even food or water, then you would need to come into the hospital or the health facility, because there are also other conditions that we'll talk about later that could appear to be food poisoning that are not food poisoning, and we would need to do some further tests to determine what we are dealing with and treat it as appropriate.
Thank you, Dr. Mugo. When we get back, we'll get to hear from Dr. Renske about her take on self-diagnosis. I'm told it is time to take a break, but we'll be right back shortly with more on food poisoning. Stay tuned.
Welcome to Mater Misericordia Hospital, Nairobi CBD Medical Center.
Development House Medical Center was opened about slightly above 10 years ago, and since then we've been providing ambulatory care to clients who come to us. The clinic is located on between Tomboya Street and Moi Avenue, right opposite the Pioneer Building.
We guarantee our patients quality standards and variety of medical services.
At Development House Town Clinic, we have the following services. We offer doctor's consultation. We also offer physician services on Mondays and Fridays, obstetric and gynecologist services on Wednesdays and Saturdays, nutritional services on Fridays. We also have a well-equipped pharmacy, a well-equipped laboratory. We have physiotherapists, and we also have just begun our wellness services as a way of encouraging preventive medicine.
We provide specialized services, that is gynecology and antenatal clinics. We provide services to the diabetics and the hypertensive patients. We give nursing services. We will do your dressing, we give you injections, we also provide some counseling services. We have specialized counselors that would give you natural family planning counseling and guidance, and you'd also get the general counseling. We also provide adult immunization, and basically for adults who want to travel, we are able to give you the vaccines that you need.
We uphold the dignity and privacy of our patients as we strive to meet your healthcare needs holistically and in a more compassionate way.
The service that you'd receive at our medical center is a value with a touch of Christ. We do not just want you to be taken care of physically, but you also think about your spiritual care and spiritual growth.
Visit us every Monday to Friday from 8 a.m. to 6:30 p.m. and every Saturday from 9 a.m. to 3:30 p.m. and get value for your money.
We ensure that you're seen within the shortest time possible, however, providing quality care.
I welcome you all to Mater Hospital CBD. We assure you of timely, efficient, and satisfactory services.
All right, welcome back, and thank you for keeping tabs with us here on Health Friday. And we are discussing food poisoning. With me in studio today is Dr. Mugo Ndirangu and Dr. Renske Leez. They're just helping us understand the broader perspective of this medical condition, of at what point should you go to hospital, seek medical attention, and what you're supposed to do. And of course, later on, you're going to look at the preventive measures and other conditions that mimic this medical condition, food poisoning. So before we went for a break, there was a question on table. Welcome back.
Thank you.
There was a question on table. We're trying to understand, is it okay for one to do self-diagnosis at home, and what are the steps that they're supposed to take in order to make sure that they're fully recovered and fit to get back to their normal routine. Remember, you can keep your questions flowing on our social media platforms. The number, just to remind you, is 0717 424 866. We'll be sampling some of them if time allows. So welcome back to our second session. We heard about your stance about self-diagnosis. Dr. Renske, are you for that?
Yes and no. I think self-diagnosis is not the same as self-treatment. I think self-diagnosis is important because it helps create awareness. You're aware of whatever the condition you experienced is before and how to handle it again. So if you are aware of the symptoms, as we have described earlier, then you would know when it is time to go to the hospital and what you can do if you're at home and so on and so forth. And then I disagree because I feel like once a person is self-aware of their condition, they do then feel like they can treat themselves. And one of the problems we do have as medics is patients developing antibiotic resistance. So antibiotic resistance is as a result of abuse of antibiotics. Abuse could be using it too frequently or using and stopping and not taking a complete course. And so as a result, when you really do need these antibiotics, they will not work. And that becomes a problem.
Thank you. So you mentioned briefly in our first session what the patient with food poisoning should expect. What are some of these procedures that they are taken through once they visit the hospital?
All right, so an individual with, for example, notices that they have many episodes of diarrhea, maybe 5 or 6 in a day, and they're vomiting quite often, and maybe there's some blood in the diarrhea, and they decide to walk into the Mater Hospital casualty. The first thing that we will need to do, of course, is to triage them, to assess their vital signs, to know what is their blood pressure, what is their pulse rate, what is their temperature, what is their oxygen levels in the blood, and then and also what is their breathing rate. Then after that, when they come to see the doctor, then we will be able to take medical history. So we should ask them when did it start, how are the symptoms progressing, are they worsening, and just get proper details of the events preceding their coming to hospital. Then thirdly, we need to do a physical examination to look for dehydration, to look for other signs that may be important in helping us to determine the course of investigations. Then now when we come to the investigations, one of the first things that we may require to do would be to do a blood count to look at which will show us the white blood cells, and that will help us to determine what kind of infection we are possibly dealing with. Is it likely bacterial? Is it likely viral? Then we would also want to see the blood level. If they've been having bloody diarrhea for some time, then we are concerned about the blood levels going low and them developing anemia. So we would want to know that as well. Then one of the other key things that we would also want to check would be the electrolytes. So we would want to see how is their level of sodium, how is their level of potassium, how is their level of chloride, and we would also want to see how is their kidney functioning, because one of the things that dehydration can cause is kidney injury. So as you're losing volume, then the blood supply to the kidney can reduce, and that can cause acute kidney injury, which could, if not addressed, could cause the kidneys to fail. Then we would also be interested to do a stool examination, especially if the diarrhea is persistent or is bloody, and that would tell us a few things. It would tell us if there are pus cells in the stool, which would be in keeping with a bacterial infection. It may also tell us if there are infections such as if there are cysts or trophozoites, which could be because of parasites like amoeba or giardia. more commonly in our setup also a parasite that's called blastocystis, that is quote-unquote occurs into amoeba. Then we may also see from the stool test what we call some starch granules, which would mean that they are not digesting starch very well, which could be because of a viral infection.
Okay, so thank you. Now,
Yes.
briefly, you've touched on some of the complications that might arise if someone doesn't seek medical attention.
Yes.
So any medical disorder can escalate into something worse. Apart from kidney failure, briefly mention the other ones without going into details so that our viewer can understand what they risk getting if not treated on time.
All right, so apart from kidney failure, they could also, because of losing a lot of fluid and electrolytes, they could also go into shock, which means the blood volume is insufficient to be able to cater for the needs of the vital organs in the body, and that can lead to organ failure. Another thing that could result because of electrolyte imbalances could be convulsions or seizures. So some patients can develop seizures, and other patients can also develop infection. If the bacteria goes into the blood, it could infect the membrane, the layers of the heart, what we call pericarditis, and that could they could have chest pain and difficulties with it could compromise their heart function. Another thing that could happen is arthritis, which is inflammation in the joints because of the bacteria spreading from the bloodstream, which is a particular type of arthritis called reactive arthritis, which can be because of some of the bacteria like salmonella. Then another thing that could happen, one of the bacteria called Campylobacter that is quite common could cause a disease that affects the nerves that is called Guillain-Barré syndrome, that could cause weakness of the legs and could ascend even up to the level of the diaphragm and compromise their respiratory function. So that could be one of the complications as well.
Great. That shows you how important it is for you to seek medical attention, or if you are to self-diagnose or treat yourself, you make sure that you are really fully healed. Now, because of time, could you please, Dr. Renske, take us through the treatment modalities and tie it up with some of the preventive measures briefly?
Okay. So we'll start with prevention because it's better than cure. So usually food poisoning, as mentioned earlier, is as a result of cross-contamination. So what we want to do is practice good sanitation. We wash our hands, we clean surfaces that we cut poultry or seafood or vegetables on to avoid cross-contamination. We also keep food well, so from temperatures. We do not keep food in a freezer that is low in temperature because that is a medium for bacteria to increase in number and reproduce. We also cool food after cooking. So we don't close the containers immediately after we cook. We let it cool and then we keep it in the fridge. Another thing that we do is we make sure we wash fruits and vegetables before we consume them to avoid eating fruits that were touched by someone else who might have had a bacterial infection that we could likely get. So that's for prevention. For management, we have two ways we could approach it. We could approach management at home and management in a hospital. Yes. So the aim of managing food poisoning is to replenish lost electrolytes. So you need to have a lot of fluids, mainly oral rehydration solution. So an oral rehydration solution is basically a combination of 6 tablespoons of sugar and half a teaspoon of salt, and you mix it with warm water or water of your choice, that is, and you drink it, preferably after every loose stool. And then another thing you could do is get paracetamol strictly paracetamol over the counter. It will compensate for fevers and also abdominal cramping. I would not recommend patients to get antibiotics because we need to first do the necessary tests to identify the cause of the food poisoning.
Thank you, Dr. Renske. Now, as we wind up, because time is against us, one of the reasons why medical experts discourage self-diagnosis, self-treatment, and especially OTC is because different ailments could present similar signs and symptoms. What are some of these medical conditions and disorders that mimic food poisoning?
Well, very important question to consider, because there are many conditions that would appear to have similar symptoms but would be different in their treatment. And one of the examples would be acute appendicitis, which is inflammation of the appendix, which is a small organ in the right lower part of your abdomen. And when it is infected, you can have vomiting and diarrhea and a fever, just like food poisoning. But one of the differences in treatment is one may need to have the appendix removed through surgery, which if we ignore would cause very severe infection. And one of the other things that could also mimic food poisoning is hepatitis, which is inflammation of the cells of the liver, which could be because of alcohol, could be because of different infections or toxins. Another thing that would mimic food poisoning would be intestinal obstruction, which is whereby part of the gut is obstructed either by a tumor, either by the gut twisting on itself, and the patients would tend to have a lot of vomiting, which may appear to be food poisoning, and that may need to be corrected surgically. Yes, and maybe finally, one of the other things that could mimic food poisoning could be what you call irritable bowel syndrome, which is chronic infection, chronic inflammation in the gut, and patients could have similar symptoms of bloating, diarrhea, or constipation, and vomiting as well. That needs to be treated by a gastroenterologist.
Thank you. Now, one statement or one word as your parting shot, Dr. Renske?
Please wash your hands.
Thank you. Wow, I like that. Dr. Mugo?
Please cook. Make sure your meats and your foods are well cooked, and make sure you refrigerate as appropriate. Yes.
As advised. Thank you very much for making time for the show and for the informative session. We really appreciate your time.
Thank you.
Absolutely. Thanks, dear viewer. Time is against us, and there is another program on standby. Our team is ready in Tongaren for the Silver Jubilee celebrations. Tongaren Parish, that is the Catholic Diocese of Bungoma, and the celebrations will be presided over by the newly appointed Archbishop of the Archdiocese, the Catholic Archdiocese of Nairobi, Philip Subira Anyolo, and the team is ready, I'm told. So immediately we close this, they'll be bringing you the events and the happenings live on our social media platforms as well as the TV. I believe you gleaned a lot or what you need on our sessions. Keep your questions and concerns coming, and we'll make sure that we get the right people to respond to them. At this point, allow me to close the discussion to allow for other programs to continue. Our camera operator has been Evans Havana. Our sound engineer is Frederick Ocheng, aka DJ Fredox. Visual mixing has been Sami Cherbor and Victor Baraza. And on the other side, of course, of the gallery, there's on the transmission desk, Peter Mwangi, aka Afro. And I've been Sasha Elizabeth, your host as usual. I wish you a great weekend. Take care wherever you are. Make sure you stay safe and sound, for we would like to see you next Friday. Goodbye.
Welcome to Mater Misericordia Hospital, Nairobi CBD Medical Center.
Development House Medical Center was opened about slightly above 10 years ago, and since then we've been providing ambulatory care to clients who come to us. The clinic is located between Tomboya Street and Moi Avenue, right opposite the Pioneer Building.
We guarantee our patients quality standards and variety of medical services.
At Development House Town Clinic, we have the following services. We offer doctor's consultation. We also offer physician services on Mondays and Fridays, obstetric and gynecologist services on Wednesdays and Saturdays, nutritional services on Fridays. We also have a well-equipped pharmacy, a well-equipped laboratory. We have physiotherapists, and we also have just begun our wellness services as a way of encouraging preventive medicine.
We provide specialized services, that is gynecology and antenatal clinics. We provide services to the diabetics and the hypertensive patients. We give nursing services. We will do your dressing, we give you injections, we also provide some counseling services. We have specialized counselors that would give you natural family planning counseling and guidance, and you'd also get the general counseling. We also provide adult immunization, and basically for adults who want to travel, we are able to give you the vaccines that you need.
We uphold the dignity and privacy of our patients as we strive to meet your healthcare needs holistically and in a more compassionate way.
The service that you'd receive at our medical center is a value with a touch of Christ. We do not just want you to be taken care of physically, but you also think about your spiritual care and spiritual growth.
Visit us every Monday to Friday from 8 a.m. to 6:30 p.m. and every Saturday from 9 a.m. to 3:30 p.m. and get value for your money.
We ensure that you're seen within the shortest time possible, however, providing quality care.
I welcome you all to Mater Hospital CBD. We assure you of timely, efficient, and satisfactory services.